This call is being recorded. If you do not wish to be recorded, please disconnect at this time.
What they are deprived of, that they're not getting a pre-existing condition.
Right, but there are cancellation notices going out. There's 1 million of them in California.
Yeah, and it's not. And what they have to do now is to send another letter that says, this is what this is going to mean to you in terms of you won't get pre-existing condition discrimination, and here are the other options that are available to you in the marketplace.
But the president has been apologetic. He's been accountable for saying something that was not the case. You were Speaker of the House. You, in many ways, were seen as an architect and a key ally on this. And this is what you said back in June of 2009 on MSNBC. Watch.
What we are talking about is affordable, quality, accessible health care for all Americans. It's about choice. If you like what you have and you want to keep it, you have the choice to do that.
Are you accountable for saying something that turned out not to be correct?
Well, it's not that it's not correct. It's that if you want to keep it, and it's important for the insurance company to say to people, this is what your plan does. It doesn't prevent you from being discriminated against on a basis of pre-existing conditions. It doesn't lifetime limits, annual limits, and the rest.
There's a bottom line to this, which I think people understand and the president has acknowledged, which is if there are not, the government has decided there have to be minimum standards that are minimum requirements in any health care plan. So if you have something and you like it and it doesn't meet what the government says you have to have, you cannot keep it. That's not what you said.
If you had your plan before the enactment of the law in 2010, if you had your plan before, there is nothing in the law that says you have to. But, you know, again, we can go back and forth on this.
Right, but this is an important deal because the grandfathering has changed. And the bottom line is the president has acknowledged, it doesn't seem like you're acknowledging, that saying to people back in 2009, hey, this is going to be easy. If you like what you have, you can keep it. This is all about choice.
You could, if you had your plan until the enactment of the law in 2000.
Good day, I am the voice of We Provoke Thought. We Provoke Thought is an organization and show that is the platform for those who have an opinion, idea, or educated information to share to the world, an outlet to voice your feelings and facts. Now today, listeners, I have a young lady on the line and she wishes to discuss about the Affordable Health Care Act, the health care reform otherwise known as Obamacare. Now understand that our mission is simply to make the American public much more literate on the health care reform, the benefits as well as the consequences, to better prepare the American public for the impact. Now, I don't believe that the government has been fair in making sure that the American public are fully aware, that they are prepared for the impact, and making them fully aware of the consequences and if benefits of the affordable health care reform. Many issues that have been raised have not been, I would say, honestly answered. And we have also found that there have been some lying, if you will, or miscommunication as they may try to explain it. But nonetheless, we'll uncover that all. Now, this young lady would like to express her discontent and her experiences with the Affordable Health Care Act, and we would like to be the platform for that. So we will continue. And we'll continue with you having full knowledge that the phone call is being recorded and that you agree to continue with the recorded call, allowing We Provoke Thought to publish this call on our YouTube channel and Facebook fan page without releasing any information leading to you. Now understand that we always would like to make sure that we keep this anonymous, but most importantly, allowing the listeners to understand and know the demographics in which we're reaching. So from there, I would like to ask, ma'am, what city and or state are you in?
Chesapeake, Virginia.
Wonderful, Chesapeake, Virginia. And let me ask you, was it snowing out there like it did up in the other areas?
No, we're clear here. It's rainy and cold, but we're in good shape. We got the ocean,
right.
You know, the currents from the ocean that keep us from that. Yeah.
All right. Well, that's good. That's good then. And today's topic is the Obamacare, or what the actual name of it is, the Affordable Health Care Reform. And interpretation and perception is the reality to the American public. So with that, I always like to ask, what is Obamacare to you?
I think the overall purpose of Obamacare is to provide health care for people who cannot afford it, and that's implemented through people that do pay into it to cover their cost. Mm-hmm.
And people are just nuts. You know, scaring old people. Talking about death panel, pull the plug on grandma. Why would they even believe that? You think we just start killing people because they're old? That's not what we do. You think we just gonna be walking down the street and go, oh, you're an old man. Excuse me, sir, how old are you? 78? You should have been dead 3 years ago.
Now, why is the health care reform important to you then?
I guess I have two concerns. I am concerned that people get quality health care, but I'm also concerned that people that work on a daily basis that contribute to the plan are sometimes charged with the responsibility of caring for other people when other people are really not caring for themselves in a responsible way as far as working or contributing to our society in general.
Talk about a wake-up call. I was paying for all the doctor's visits, insurance premiums, and medical costs out of pocket. All these expenses were keeping me from living the carefree lifestyle that I wanted. Then the government told me about Obamacare. Now with Obamacare, I don't worry about my health care. I eat whatever I want, whenever I want. I get all my prescription drugs for free, and there's no more coverage gap. I no longer need to worry about pre-existing conditions. We can see any doctor whenever we want for any reason, and so can everyone else.
Obamacare is not for everyone, like Congressman. If you are already healthy, do not use Obamacare, as you will see your premiums go up. If you are a sick person, do not use Obamacare, as you will see your premiums go up. Many people on Obamacare may experience longer wait times and fewer doctors, and denial of your treatment of choice. If you are faced with a healthcare situation, you may be denied treatment through government rationing.
Obamacare even covers my kids up to age 26.
If you experience a recession lasting more than 4 years, stop taking Obamacare and contact a travel agent to move to the Bahamas or New Zealand.
And the best thing is that Obamacare is free.
Obamacare is not free. Obamacare will increase the national debt by $863 billion in 10 years. Your taxes will go up $569 billion by 2019. If you see a major jump in your premiums, you should opt out of Obamacare immediately. Opting out of Obamacare is illegal and will incur major fines and penalties unless you are a union member who received a special waiver from the Obama administration. Obama is not responsible for the negative effects on the economy, your pocketbook, your freedoms, or your health.
Obama solved all my problems.
Obamacare. Live your carefree lifestyle.
Right. Now, there's been a lot of problems with the launching of the healthcare reform. One being the website. I mean, some would say that it was like they had 12 monkeys trying to put this thing together and then launch this whole website for billions of people to immediately be able to switch coverages. And what we found is that folks who had coverage was losing coverage, and folks that never had coverage wasn't still able to get it. And prices were, folks were looking at, at one point paying, $200-$300 to now paying somewhere in the crazy range of $800, and then sometimes, tripling that. So with that, do you think that the country needs a reform in healthcare?
Excuse me?
Do you
Would you
think
ask me
that the
that
country?
again?
Yeah. Do you think that the country needs a reform in its healthcare?
Oh, absolutely. But I believe that people that are that presently, before this all began, have a insurance plan that they're happy with, that they have a doctor that they're happy with.
Right.
I don't know why that should be challenged. And the promises that seem to have been made in that regard are not happening. And when you have people, I have people that I know that run their own business, and they're being their rates are increasing to the point where they are having to let people go. And
right.
And so it's complicated, and it seems to have this domino effect opposite of what the original intention was. And so,
Indeed. So who benefits from Obamacare or the Affordable Health Care Reform? Who benefits from that?
That's a hard question for me to. That's a hard question for me to answer, because the people that I'm in contact with are having their rates increased. They're having their doctors no longer, available under the stipulations of the care,
right.
And so they're definitely not benefiting. And if there are not enough people that will sign up to support and cover the cost of those that can't afford it, then I don't know where the benefit is myself. I mean, I think if there's an emergency situation, I don't know of any hospital that legally can turn down someone from care. And in the area where I live, there are so many clinics here that people get free health care, and doctors that are willing to provide that, specialists that are willing to provide that, and there's a great connection of care here in the area where I live. So myself, I don't see the real need here. Maybe I'm not informed well enough that people are going without care. But
and I'm glad you said that. I'm glad you said that, because that is the key right there. That a lot of the American public aren't informed. They're not educated on exactly what the Affordable Health Care Reform is about.
Now I'm covered.
Now for the first time, you can be covered. If you've been waiting to be covered in mandates, regulations, and new fees, the time is finally here. Sort of. You guys stop showing that screen. So make some coffee.
I'm covered.
Approach life with reckless abandon. Kick your feet up.
I'm covered.
Because you're going to be in the waiting room for quite a while. But don't you worry your pretty little head off. First of all, it wouldn't be covered.
We're covered.
No, I said it would not be covered.
Now we're covered.
No, that's not... Yeah, I don't think you understood what I meant by covered earlier. It was a little bit ironic. Seriously, stop showing that screen. Healthcare.gov is not responsible for fulfilling any of the expectations, mandates, legal requirements, hopes, or dreams of any users. Results may vary. Consult your Obamacare-approved doctor or pharmacist to find out if Obamacare is right for you. Current waiting lists to have your doctor chosen for you are unavailable and will remain so for the foreseeable future. Obamacare may cause wait times, a decline in healthcare quality, money loss, political activism, anger, despair, hopelessness, frustration, European envy, dependence, and nausea. If you discover that your premiums have gone up as a result of Obamacare, please note that the program is working as intended and refrain from complaining. Call your doctor if you experience anxiety for longer than 4 hours. If you wish to opt out of Obamacare for any reason, please start a multi-million-dollar business, join a union, or run for Congress.
They're not educated enough on its benefits. They're not educated on the consequences that, because for one, I believe that the biggest problem is that they had the insurance companies write this whole deal. And that's almost like giving a blank check to someone and saying, go ahead, do what you want with it, and then come to me later, and we'll see how this can benefit the other person. And knowing that, when you put the insurance companies in charge of something such as this, whose best interest do they have? We've already seen the bailout with the banks. We've seen insurance companies in the past fall and being held up by the shoulders of the American public. And here we have an issue where you have something serious like the health care reform, something very serious like that. You're putting in the hands of the very folks that failed in the beginning. There's no real bipartisanship when it comes to something like this. And I would add, will very impact, but would you agree that the Americans are already feeling the impact, negative impact that is, of the affordable health care reform?
Well, I can only go ahead.
No. Would you agree that the Americans are feeling the impact of the negative impact of the affordable health care reform?
Without a doubt. I mean, the personal incidences that I've related to you are people, that their insurance is doubling. Some people are having to, of course, change providers, and
right.
I don't hear anything good. I mean, personally, I don't hear anything good.
Has it affected you negatively?
No, not me personally.
No. Okay. All right. And
no, well,
no,
the only way that
speak on.
The only way that I can say it affects me is because my husband has his own business, and we depend on customers. It's a small business, but we depend on customers, and if our customers are overcharged in any area of their life for their insurance and things like that, it's going to trickle down and affect the volume of business that we get.
Indeed.
So I can't say that anybody is not affected by that. I mean,
so the affordable health care becomes a economic disaster of all across the board. Then that would be fair to say, would it not?
In my opinion, it is. I just can't support it. I think the idea, the purpose, sounds very ideological and great. Great. Everybody gets health care. That's great. But there's always a bottom line of who's going to pay for that. And so,
as my grandfather used to say, that nothing is free. Nothing in this world is free. So with that, and I know this may be a difficult question to answer, and if you can't answer it, that's fine. But how can America's health care be resolved, and what would you say would be a better solution?
Well, I think a lot of it goes back to something deeper, and that is the job situation that's in our country. If more people were working, they would be able to afford health care. If there were, that's a bottom line of the strata of our country. How years ago people wanted to work, they wanted to be self-sufficient, they wanted to provide for their family. And I know there are cases where people absolutely cannot work, and I'm not in that category, but the people that are able-bodied and that can work should, be able to work. And I think that's where the heart of everything is, that desire to want to work and be self-sufficient. I think that would solve a lot of problems.
Wow, and it didn't take two terms for you to figure that out. That's crazy.
No.
It didn't take two terms for you. You just gave. I think that was the perfect answer right there. So with that, I'm going to come to an end. I thank you. I thank you for allowing We Provoke Thought to be your platform to voice your opinion. I always like to give the listeners and the callers the last word. And with this, I'm going to leave you with this statement, and you can follow through from there. If you had the power, what would you do with it?
Well, I think there are things that I think jobs would be a big thing. I think our economy is suffering right now across the board. All our, investments that people are trying to make are not doing well, and I think it all stems from. Well, personally, myself, I'm a moral person, so I feel like some of it has to do with the morality and the ethics of where you're coming from.
Exactly.
And I think that's something that's not pushed in our country. Now anybody has a platform, and I'm not against personal, the right to speak or whatever.
Right.
But I think the morals and the spirituality of our country is frowned upon. And to me, that's the basis for getting along with other people, and just, a belief in God is the bottom line for me.
Wow.
That's where I'm coming from.
And we're going to stand right behind you with that one. Again, it didn't take two turns for you to come up with these answers. That's incredible.
No.
Well, I thank you again out there in Chesapeake, Virginia. Again, I always like to thank all of my callers there for We Provoke Thought. And for that, do not apologize. I'm going to sit behind you on this.
Okay, thank you.
This call has been recorded.
Okay, ladies and gentlemen, if you will, look right here.